Richard and I have had some really good, thoughtful discussions, and he's amazing. He's done so much, and he's a caregiver. And the thing that we've both been talking about is this caregiving moonshot. We have really great minds here, and we have realized that we've got a lot of thought leaders in caregiving, from tools to support to all. It's a huge spectrum. Gosh, it's such a broad spectrum, a wide spectrum of thoughts of how to address caregiving. It's not disease state. Caregiving covers everyone. Um,
Mhm.
and so with these thought leaders, we could be the go-to for caregiving. It's knowledge, it's resources, it's how to address things. And I think that has far reach because nothing is out there that exists. It's so fragmented. Caregiving is fragmented, and everything that supports caregiving is fragmented. But the caregiving moonshot that Startup Health can now consolidate all of these important and valuable things out there to help caregivers.